Good. Hi, I'm Dr. Daniel Shapiro, and I am a board-certified plastic surgeon here in Paradise Valley, Scottsdale area for the last 21 years. I'm certified by the American Board of Plastic Surgery. Today we're going to talk about different kinds of facelifts. I'm always asked by patients, what are the differences of different kinds of facelifts and why would I have one versus the other? Well, I think the most important thing is to understand that it's the surgeon that's performing the facelift, and why they're performing it is the most important thing. Newer contemporary facelifts don't pull the skin at all, and when you see celebrities that look kind of strange, it's because their skin has been pulled too tight. So if we go from simple to more advanced, the basic kind of facelift that is the most simple is something called a cheek lift, which is actually a skin lift. And what is done is an incision is made along the ear and the sideburn down to the earlobe, and that mostly treats just the area beneath the eyes to the jawline. And not a lot of people are really great candidates for that. The reason being is it doesn't treat the neck and it doesn't elevate the facial fat and treat the jowls. So those patients that have very nice skin that are generally 40 to 45 or less are nice candidates for a cheek lift. And the nice thing about that is it's a simple procedure. The recovery is very quick, about a week, and that can be done in the office under local anesthesia. People also talk about that as being a mini facelift, and the difference between a mini facelift and a more advanced facelift is, like I said, the amount that it treats. A mini facelift is basically that cheek lift. And again, it's a simple procedure that can be performed in the office, and it gets you many results. So that's why it's called a mini facelift. And again, in some people, that's a great procedure. And the beautiful thing also is that can be added with fat transfer, laser, so it can be a comprehensive procedure that's done in the office. The more contemporary advanced facelifts is something called a SMAS facelift, and that's what I do most of, and that's what the modern facelift consists of. And really what that is, it's a procedure that addresses the lower face, so that area beneath the eyes, down, all the way down to the neck. The incisions for that are at the sideburn, inside the ear, along the back end of the hairline, and usually a small incision beneath the chin. The beauty of this procedure is that the facial fat is elevated to give people a much more voluptuous, youthful look, giving back the youthful curvature of the face. The recovery for that procedure is a bit longer. It's usually all the stitches are out at about 10 days or so, and people are swollen, occasionally bruised, but I think that people can interface with their family or friends at about 2 weeks, 10 days to 2 weeks. That is really the gold standard procedure. The beauty of that procedure is that you can also do it with some eyelid procedures, also do a brow lift. You can do fat transfer to areas where you've lost some of your facial fat, and it really is the gold standard procedure. When people talk about a full facelift, oftentimes they're talking about having the brow lift done along with the eyes and that facelift. So that is a different term. But the three different kind of facelift that we just talked about were the skin lift, the mini facelift, and the facelift, the SMAS facelift, which is what I do most commonly. Thanks a lot.